This is Plant-Based Briefing. U.S. farm workers advocates call for greater protections as bird flu spreads by Julia Conley at commondreams.org, posted at all-creatures.org. And I'm Marian Erickson. This is the Plant-Based Podcast where I curate and narrate with permission a variety of articles on plant-based and vegan living in about 10 minutes or less every weekday. And I'm pleased to have permission from All Creatures to share their content. They compile so much wonderful information. And they also have a free PDF downloadable resource called What to Eat When You Don't Eat Animals, menus and ideas to inspire people who want to eat as if life is precious. It's not just recipes, it's a really great kind of starter guide. It has shopping secrets, what kind of vegan foods can you find in grocery stores, what to order when you're dining out. It also has information about the impact of eating animals and quotes and stories to inspire, but it's a fantastic guide, so check that out. There's a copy linked in the show notes. And just for context, today's article was published on May 30th. So now let's get to today's plant-based briefing. U.S. farm workers advocates call for greater protections as bird flu spreads by Julia Conley at commondreams.org, posted at all-creatures.org. U.S. health officials in recent months have said the avian flu that's been detected in chickens and cows in some states poses little risk to the general population and to commercial dairy products. But as a third farm worker's diagnosis with the illness was reported Thursday, advocates said officials must do more to protect the laborers who are most at risk. A farm worker in Michigan was the second person in the state to test positive for H5N1, the avian flu that's currently circulating, and was the first person to report respiratory symptoms. A worker in Texas was also diagnosed with the illness in March and had mild symptoms. The person whose case was announced Thursday contracted the disease after being exposed to infected cows. As of late last week, there were 58 cow herds known to be infected across the United States. The Guardian reported on Wednesday that there have been anecdotal reports of other farm workers exhibiting mild symptoms. And as of last week, federal officials said an unspecified number of people are being actively monitored for signs of avian flu, but noted that only 40 people connected to dairy farms had been tested. Don O'Connell, Assistant Secretary for Preparedness and Response at the U.S. Department of Health and Human Services, told reporters on May 22nd that authorities are preparing 5 million doses of a vaccine against H5N1, often referred to as bird flu. Officials have not yet decided whether shots will be offered to farm workers when they're deployed later this year. Elizabeth Strader, Director of Strategic Campaigns for United Farm Workers, UFW, said that while vaccines are being prepared, authorities must ramp up a testing campaign to stop the spread of the virus and protect the country's 150,000 dairy farm workers. The U.S. Department of Agriculture unveiled a push earlier this month to encourage workers at affected dairy farms to get tested, offering them a financial incentive of $75. But with undocumented immigrants who lack health insurance making up a large portion of the agricultural workforce, said Strader, many will likely feel they can't risk testing positive and being required to stay home from work for just $75. That's not even a day's lost work, Strader told The Guardian on Wednesday, and that's a very bad gamble for someone that might miss weeks. They're unlikely to go to the emergency room for anything that isn't life-threatening. In fact, they're avoiding testing because they know they won't get any compensation if they're ordered to stop working. Bethany Bogus-Alcater, Director of Research and Public Health Programs at the National Center for Farmworker Health, told USA Today that farm workers are currently being treated as canaries in the coal mine. But they could be trained to be frontline public health defenders, with authorities sharing far more information about the disease with them. Education needs to be a part of testing efforts, with time for workers to ask questions, Alcater told the outlet. As the third human case of H5N1 was reported Thursday, UFW called for protective equipment and paid sick leave for farm workers. Earlier this month, the Centers for Disease Control and Prevention asked states to provide personal protective equipment to farm workers. USA Today reported this week that the response has varied from state to state. State health departments in California, Texas, and Wisconsin, which have large dairy industries, all said they have offered to distribute such equipment. Chris Van Dusen, a Texas Health Department spokesperson, said 4 dairy farms had requested protective equipment from the state stockpile. He said other farms may already have had what they needed. Spokespeople for the California and Wisconsin health departments said they did not immediately receive requests from farm owners for the extra equipment. Amy Liebman, Chief Program Officer for the Migrant Clinicians Network, criticized the federal government's current response to the spread of H5N1 and told The Guardian that the focus should be on the dairy farm worker. You just listened to U.S. farmworkers advocates call for greater protections as bird flu spreads by Julia Connolly at commondreams.org, posted at all-creatures.org. And I'm your host, Marian Erickson. This is just another glimpse into the whole huge, complex situation of avian flu. Another example of animal agriculture offering nothing good and creating so many harms. We know it's harmful to health, to the environment, to biodiversity, to wildlife, to the slaughterhouse workers, to the farmers, to world hunger, to pandemics, to antibiotic resistance, to our forests, our oceans. Just nothing good about it at all. And as an ethical vegan, my focus is so much on the animals, the defenseless, innocent animals. But humans are defenseless and innocent in most of these situations as well, and being taken advantage of. I remember watching Food Inc. the first time and being educated and horrified at the treatment of the immigrant workers, the farm pickers, treated like absolute crap and basically held hostage, especially when they had family members living with them as well. I recommend watching it and looking out for those segments about the immigrant workers. And looking back to COVID, again, the workers were the ones that were basically the test subjects. Nobody cared about them. Certainly the government didn't care about them. The people who wanted their meat didn't care about them. And of course, the corporations didn't. Shocker. But I do appreciate articles like this that highlight things that people don't necessarily think about. But if you'd like to listen to some other episodes about pandemics and avian flu and how it's related to the food we eat, I'll link these in the show notes, but you might want to check out bonus episode 1, Go Vegan or Risk Another Pandemic, 157, How Concentrated Animal Feeding Operations or CAFOs Fuel Pandemics, 391, The Connection Between Deadly Pandemics and Our Diets, 393, The Use of Chickens in Agricultural Research, 476, Veterinary Profession Should Not Condone Killing Animals by Heat Stroke, 728, When Tyson Depopulates Chickens, Taxpayers Are Left Footing the Bill, 785, Bird Flu Infects Dairy Cows and Farm Worker in the U.S., 815, Bird Flu Highlights the Problems with Factory Farming. So feel free to check those out, and please share this episode with anyone who might benefit, and thanks for listening.